I'm the head of the global commercial organization for Amgen. Have responsibilities for ensuring patients get access to drug. I've been doing this for about 35 years. Lived in 5 countries, 4 continents, including a good year in Melbourne. So Australia is probably the #1 country in my JPAC region, right? So Amgen established Australia about 25 years ago. We've always been a fairly regionally based organization, North America, Europe, and Australia. So Australia is this innovative, creative market that exists out here that I'm using as a center of excellence as I build out our business for the first time in Southeast Asia, China, and Japan. Brilliant competitors, right? I mean, I came down for 2 things, right? One, to come and say thank you, right? Thank you because their commitment to our mission of delivering to patients is one of the best in the world. Number 2, to congratulate them because their ability to drive business and get to patients is better than I've ever seen before. A drug like Prolia, which is for postmenopausal osteoporosis, they have the leading market share of the world. The rest of the world hate Australia because I use Australia consistently as the hurdle against which I'll measure everyone else. So I come here because they're good. Well, I learned how to spell pharmacoeconomics in Australia back in 1996, right? And it's probably one of the more sophisticated and well-known systems in the world. And if you think about where we're going as an industry, the whole concept of pharmacoeconomics or value-based pricing is essentially where we'll land. Because if you don't land on a value-based price, you move to a budget price, right? Or a budget system, which is really not where we want to be. So what Australia has developed that Canada followed and now the rest of the world is trying to approach is what we use. A lot of our clinical work is done in Australia. Strong expertise, strong access to people. We do a lot of work. Skills around access, reimbursement, very good. And a sophisticated marketing team over here. So I come here to learn more than I do to actually bring knowledge. One of the reasons I came to Amgen was to actually help them move from where they were to where they need to be for the next 25 years. And that was an evolution of both the change of the portfolio, the change of the geographic footprint, and the level of competitiveness in the product portfolio. So it's been a fun process, you say. We were very specialized. We still are very good at running specialty markets. The evolving into the Prolia market, into the Repatha cardiovascular market, is a real test of our ability to go into a larger primary care type markets in a highly competitive field. Very exciting, right? So the next 5 years means we're launching 4 or 5 new products into either existing therapeutic areas or new therapeutic areas. So bringing real innovation to the Australian market as our portfolio evolves. So reaching more patients than we've ever done before.